UNNA boots inelastic paste wraps. Before applying an UNNA boot, you must gently wash and dry the extremity, followed by applying a moisturizer to the site. If wound is present, clean the wound and apply appropriate topical dressing. Remember, topical product should be one that can remain in place for several days without changing. Flex foot to 90 degrees and maintain position throughout the application. Begin bandaging on the top of the foot and at the base of the toes. Continue wrapping up the leg using spiral technique, overlapping each previous layer by 75%. The bandage should be loosely wrapped around the foot and the heel and around the leg in a spiral fashion. Do not use tension. This covers leg with at least 2 layers. As you're wrapping up the leg, smooth and mold the bandage with your hands. If you need to, you can cut the bandage as needed to prevent wrinkles, pleats, and folds. You can also restart the wrap where the bandage was cut. You will continue to do this procedure until you are about 1 inch below the knee, which is 1 finger width below the posterior bend of the knee. As bandage dries, it becomes rigid. Upon ambulation, the rigid bandage restricts outward movement of the calf muscle, therefore directing the contraction force inward and improving the calf muscle pump and venous flow. Once you reach the top of the knee, you can cut off the excess bandage, not a problem. According to the specific product instructions, apply cover wrap, usually an elastic or cohesive bandage, using 50% overlap. The product that we're currently using includes a cohesive bandage. Start the cohesive bandage at the center of the ball of the foot with the lower edge at the base of the toes. Continue wrapping up the foot with 50% overlap. Upon reaching the heel, start the wrap by pulling 6 to 7 inches of bandage away from the roll. While bandage is stretched, wrap around the heel area. When reaching the ankle, stretch bandage out another 6 inches, followed by relaxing bandage back to 50% tension. Wrap around the ankle 2 turns at 50% tension. Continue up the leg with 50% tension and 50% overlay, stopping at the top of the paste bandage. Note, an overlay of 50% more or less will result in inconsistent higher and lower compression pressures. Cut any excess bandage upon reaching the top. Observe skin distal to the bandage for adequate circulation, such as color, pulse, and warmth. Removal of UNNA boot. You would first remove the bandage with scissors or unwrap the bandage. Begin at the bottom of the boot and cut upward to the ankle. Cut on the side opposite of the ulcer and use caution to keep the scissors away from the anterior tibial area to prevent trauma. Frequency of change, wear time may range from 3 to 7 days or when they begin to loosen, slip, or become saturated.